Hello guys. I want you to be focused because this is a very long lecture. Today we're going to talk about erectile dysfunction. Erectile dysfunction is defined as a persistent inability to achieve or maintain an erection satisfactory enough to allow penetration and full sexual intercourse. So this is the definition. This condition can be a source of significant distress for patients as it affects not only their intimate lives but also their psychological well-being. In the majority of cases, erectile dysfunction results from multifactorial origin involving both organic and psychogenic factors. In other words, it can be caused by physical disorders such as vascular, hormonal or neurological problems, but also by psychological factors. Erectile dysfunction can be much more than a simple sexual disorder. In fact, it is often seen as a warning symptom or early indicator of certain serious pathologies, notably cardiovascular disease. Therefore, in the presence of erectile dysfunction, it is important to look for possible underlying cardiovascular disease, as this condition can be a valuable diagnosis opportunity to prevent serious complications such as myocardial infarction or stroke, especially in elderly patients. Where the diagnosis of erectile dysfunction is very simple. Questioning the patient is an essential step in the diagnosis of erectile dysfunction. It collects important information about the patient, including age and medical history, such as an underlying pathologies that are more likely to contribute to this ED: diabetes, hypertension, heart failure, neurological diseases, episode of depression, or trauma. Some major surgical procedures like prostatectomy or cystoprostatectomy can have a direct impact on sexual function, notably by disturbing the nerves or vascular arteries involved in erection. An exposure to toxic symptoms and medications like smoking or excessive alcohol consumption, which are well-known risk factors for ED. Certain medications such as beta blockers, hypolipidemic or psychotropic drugs can also cause or aggravate erectile dysfunction. It is important to determine whether ED is primary, meaning presents since the beginning of sexual life, or secondary, meaning appearing after a period of normal erections. The nature of a dysfunction such as insufficiency, rigidity, inappropriate duration or frequency of erection, the presence or absence of morning and nocturnal erection is crucial, as spontaneous erection in the morning generally rules out any organic causes. It is important to assess whether libido and orgasm are preserved or impaired and ask about the relationships within the couple. Is there any relational tensions or a lack of communication that can aggravate or even be the cause of ED? Clinical examination is another important element of the diagnosis, as it allows us to look for physical signs related to ED. Urogenital examinations, including an assessment of secondary sexual characteristics such as hairiness, and an examination of external genitalia, and a digital rectal examination to look for any abnormalities. Cardiovascular examinations, including cardiac auscultation, blood pressure measurement, and palpation of femoral and distal pulses to detect any possible vascular insufficiency. Neurological examinations to evaluate the sensitivity reflex and to check if any neurological abnormalities involved in the erection mechanism. Finally, a psychiatric evaluation to determine whether the dysfunction has an impact on the patient's emotional state, such as depression or mood disorder. Psychological aspect can not only be the consequences of ED but also a primary cause. So how to differentiate between psychogenic and organic origin of ED? There are so many clinical and paraclinical elements that allow us to suspect that erectile dysfunction is linked to psychological causes. First one, a sudden onset. Erectile dysfunctions appear suddenly with no warning sign. It is often associated with specific triggering events such as intense stress or an emotional difficult situation. Recent anxiety-inducing event. The occurrence of disorders in the previous 24 months in connection with stressful or traumatic event, for example, a breakup, personal or professional conflicts, reinforce the likelihood of psychogenic origin. Intermittent attacks. ED occurs sporadically with the normal periods alternating with periods of difficulty. Performance may also vary according to a partner or situation. Presence of nocturnal and morning erection. The fact that the patient continues to have spontaneous erections contractions, either during the night or on awakening, is a reassuring sign. This shows that the physiological mechanisms responsible for erections are working properly, which helps to rule out any organic causes. Possibility of masturbation. The ability to achieve an erection during masturbation suggests that the difficulty is not linked to a physical problem, but rather to a psychological factor. No abnormalities are found on physical examination, suggesting a psychological cause. And finally, the absence of biological abnormalities, such as hormonal, metabolic, or vascular disorders, also supports the fact that ED is from a psychogenic origin. On the other hand, clinical or biological tests point to an organic origin of ED. The presence of a medical or surgical history, like diabetes, hypertension, or cardiovascular disease, or major surgical procedures, as we said before, are often associated with ED. Primarily erectile dysfunction, meaning that the erectile dysfunction has been present from the start of sexual life. This usually indicates an underlying organic abnormality, such as congenital or vascular problem, is present. Gradual onset of symptoms. Unlike psychogenic cause, an organic origin is often marked by slow, insidious onset of disorders, progressive worsening or stability of disorders. Disorders do not fluctuate according to circumstances or partners. They progressively worsen over time or remain constant, which is typical of physical causes. Problems present with all partners. Constant erectile dysfunction, regardless of the partner or relationship context, is a strong argument in favor of an organic cause. Total absence of nocturnal or morning erections. When the patient no longer reports any spontaneous erections, these reflect physical damage to the mechanism required for erection. The inability to achieve an erection, or even when alone or during masturbation, reinforce the hypothesis of organic damage. The presence of physical signs or abnormalities on examination, such as neurological damage or signs of hypogonadism or vascular abnormalities, is a major factor in suspecting an organic origin. Finally, an abnormal biological finding, such as dyslipidemia, hyperglycemia, or hormone deficiency, often confirm an underlying physical cause of erectile dysfunction. When it comes to paraclinical examinations, there are so many additional exploration in case of a suspected organic origin. Let's start with the first one, biological tests. When an organic cause of erectile dysfunction is suspected, a set of biological analyses is performed to assess various possible causes and identify underlying risk factors. Fasting blood glucose, used to screen for diabetes or chronic hyperglycemia, which are common causes of vascular disorders affecting erection. Lipid panel includes total cholesterol, HDL, LDL, and triglycerides, as lipid abnormalities such as hypercholesterolemia can contribute to vascular insufficiency. A complete blood count assesses the patient's general condition, particularly in cases of anemia or associated infections. Creatinine and electrolyte panel to evaluate renal function and detects electrolyte imbalance that may be linked to an underlying pathology. Liver function tests include transaminase and other markers to detect liver impairment, which may indirectly contribute to ED. The testosterone level is essential for detecting androgen deficiency or hypogonadism, which may be responsible for ED. And finally, PSA or prostate-specific antigen, which is recommended for men over 50 years old or for those with a family history of prostate cancer to screen for possible prostate pathology that could affect erection. Next, there is some imaging examination, like penile Doppler ultrasound. This imaging test is recommended when an arterial abnormality is suspected. It allows the evaluation of the cavernous arteries by measuring blood flow velocity. The Doppler ultrasound identifies penile arterial insufficiency. This ultrasound also allows the detection of penile structural abnormalities. In certain cases, additional investigations may be necessary, like iliac arteriography, used to visualize the iliac arteries and check for stenosis or vascular obstruction affecting blood flow to genital organs. Nocturnal penile rigidity test, which measures the quality and frequency of nocturnal erections and help distinguish between psychogenic and organic origin. For any patients with erectile dysfunction associated with cardiovascular risk factors, a comprehensive cardiac assessment is essential. This includes exercise stress tests to evaluate exercise tolerance and detect sinus myocardial ischemia, and ECG CT exam to check for any arrhythmias or signs of coronary artery disease. And finally, coronary angiography, if necessary, performed in cases of suspected severe coronary artery diseases to confirm the diagnosis and plan appropriate management. Now let's talk about the treatment of ED. The treatment of ED is based on two main principles that address both the causes and consequences of the disorder. The treatment of the underlying cause, meaning the etiological treatment. This involves treating the disease or condition responsible for ED. For example, if the dysfunction is linked to a condition such as diabetes or hypertension, this condition must be managed to improve the symptoms. And the second principle, the psychological and sexological support, especially when emotional or relational factors exacerbate the problem. Psychological support in this case can help reduce performance anxiety, improve communication within the couple, and enhance self-confidence. There are so many available treatments for ED. These treatments aim to directly improve erectile function either as a complement to or in parallel with treating the underlying causes. Symptomatic treatments. These help induce or maintain an erection without necessarily addressing the root cause. They are often used as a first-line treatment, especially when a quick solution is needed. Let's start with this first one. Phosphodiesterase type 5 inhibitors. These are the first choice medications for treating erectile dysfunction. They work by increasing blood flow to the penis, facilitating an erection when sexual stimulation occurs. Keep in mind that before using these medications, it is essential to consult a cardiologist, especially for patients with a high cardiovascular risk, such as a history of heart attack or heart failure. These drugs are strictly prohibited in individuals taking nitrates derivatives such as nitroglycerin used for heart disease. Combining the two can cause a dangerous drop in blood pressure. Second line, intracavernosal or intra-urethral injections of prostaglandin E1. These treatments involve injecting a medication directly into the penile tissues, which is called intracavernosal, or introducing it into the urethra, called intraurethral injection. Prostaglandin E1 is a substance that works by dilating the blood vessels to induce an erection. The potential side effects associated with this treatment may include localized pain at the injection site, which can be uncomfortable for the patient. A hematoma or blood accumulation under the skin may also occur. A prolonged erection, also known as priapism, can develop. This is a serious condition that requires immediate medical intervention to prevent severe complications. The third line, the use of vacuum, or what we call the vacuum pump with a compression ring. This mechanical device is a non-medical alternative to help achieve an erection. The manual or electric pump creates a vacuum around the penis, which draws blood into the cavernous bodies and triggers an erection. This treatment is particularly useful for patients who cannot tolerate medication or those who do not want to use any injections. In certain cases, especially when the cause is clearly identified and localized, a surgical intervention may be proposed. The two main approaches are penile revascularization, which involves restoring blood flow to the penis by repairing or bypassing blocked arteries. This procedure is reserved for younger patients who do not have neuropathy or nerve damage or diabetes, as these conditions could reduce the effectiveness of the intervention. The goal is to enable a natural erection by correcting a purely vascular problem in this situation. Second surgical intervention is penile implants. This treatment involves implanting mechanical devices into the two cavernous bodies of the penis to induce an artificial erection. The devices consist of two implants inserted into the cavernous bodies of the penis. This implant gives the patient the ability to control their erection mechanically. This type of treatment is particularly suitable for patients who do not respond to other available therapeutic options, allowing them to improve their quality of life and personal satisfaction. The psychological aspect often also plays an important role in ED. Even when the cause is organic, psychological and sexological follow-up helps reduce anxiety related to sexual performance, improve communication within the couple, and address potential traumatic experience or emotional blockage. And finally, cardiovascular management. As cardiovascular disease being a common cause of erectile dysfunction, the management is a part of the overall approach to the condition, controlling the existing cardiovascular risk factors and optimization of current treatments to adjust or change certain medications that may exacerbate erectile dysfunction. I hope you understand everything, and if you have any questions, please leave them below in the comments and I will be glad to answer them. Thank you so much for watching until the end, and don't forget to subscribe and like this video, and I hope to see you in the next one. Thank you and bye.